So, where does health equity fit into value-based care models?
I'll
Um,
let you take that one.
I'm happy to. So, we believe that value-based care models, if approached properly, can be enabling to reducing disparities in outcomes. And the reason that I say that is that it really affords both health systems and enablers, if they partner and join hands, to redistribute funds in a way that supports the patients that need those funds the most, right? And so as Wildflower talks about a personalized solution, where both the digital experience and the human services experience are personalized to the needs of a patient, it means those patients that fall low on the patient activation measure, meaning that they are not enabled to do the things that they're supposed to do, would automatically receive more resources. Those patients that come in with risk factors that are higher rather than lower, that include social and demographic factors and not just clinical factors, would receive more support than those that don't have those risk factors. And so the solution really, because we sell it under value-based care and we have control over the resources we're deploying against those patients, it enables us to make sure that the patients that are most in need receive the most dollars, for lack of I know it sounds cold, but they receive the most services to enable their success on the back end. And without that, if you're in a straight up fee for service environment, it's almost impossible to do that because every patient receives the exact same thing on the back end of it. And that just perpetuates the cycle of continuous like health equity problem getting worse and not better.
I would say that I agree with all that you've said, and I would also say, just to step back for a minute to level set the difference between value-based care and fee-for-service care, right? So the it's become so much part of a lexicon that we don't actually pause to think what is the idea. The idea is that you're giving value in the care that you deliver. You're not just seeing the patient to check off a box that you've seen them, you've done this procedure. You're actually looking, therefore, not just in delivering the care, but looking at the outcomes and the impact, so that you're then getting, value-based care is compensation based on you demonstrating that you have delivered value. If therefore you have disparities and inequities, then you're doing the same thing and you're hitting with a blunt instrument, but you're not getting the right outcomes for this subset of people. So if you have the health equity lens in the way you deliver care, then you're thinking about how can I make this visit have the outcome in this population that is desired. And so if the patient is coming to your door where they have health literacy challenges, nutrition challenges, transportation challenges, solving for those will help you to demonstrate the value that you intend to value. So I think health equity and value-based care are actually twins, and they are both working in the same direction, because if you're just doing the same thing you do for everybody, it will work for everybody who doesn't have all those other barriers that have to be overcome. But when you think about an equitable approach to healthcare delivery, then your goal is to deliver value, and in so doing, you have to address all those barriers that patients are coming to the table with.
And taking us back to one of the previous questions, the question there was, you can't just improve outcomes at the population level, because each of these disadvantaged subgroups are small parts of this population. And so we've got to be really, really careful here that even in a value-based care setting, that the quality metrics that we're tracking and are rewarding against are aligned with our goals on health equity, right? And so it can't just be that the population has to have better outcomes. It really has to be that the Black maternal population has better outcomes, or the Hispanic population has better outcomes, or the Native American population has better outcomes. And so again, we get back into this conundrum where if you're measuring the success at the program level at a single health system, and those populations are small, can you have enough confidence in your data to know whether or not something is working? And it gets us right back to the beginning, which is we have to work together across health systems and across states and across payers, which drives a lot of other interesting conversations, and whether or not there's transparency in data and whether or not we can standardize some of these approaches, et cetera, et cetera. But yeah, value-based care it really is enabling, but you have to do it right.